Hello and welcome to Health in the Heartland, a program dedicated to the health issues that affect you. I'm Karen Blakelock, and when sudden cardiac arrest happens, seconds count. And joining me this episode to discuss an important life-saving resource available in our community called PulsePoint, Sharon Wright, who's the Chief Nursing Officer with Hardin Memorial Health. Next I have Bob Hammonds, who's the 911 Dispatch Director, Emergency Dispatch Director. And then we have next to us is Jamie Armstrong, who is the Supervisor of the Emergency Medical Services, and John Malcolmson, who is the Director of the Emergency Medical Services for Hardin County. We're going to be discussing this important new resource that we have, which is called PulsePoint. And we need to start really, Sharon, by talking about why seconds do count with sudden cardiac arrest. Tell us a little bit about that chain of survival.
Well, the American Heart Association outlines for all of us what steps are needed to survive or have the best chance of survival of a sudden cardiac event. And the first step is activation of the 911 system. And by doing that, you're calling for expert help to come to the scene. And then second step is early provision of CPR. And really important for our community watchers that they understand how important that CPR is. It actually, by giving chest compressions and ventilations to the patient, provides blood flow to the critical organs until the emergency responders arrive. And then the next step is early defibrillation, advanced life support, and those steps are provided by our EMS workers. And then lastly, that you have integrated post-cardiac arrest care, which we would provide in the hospital.
So PulsePoint, how does it actually fit into this chain of survival?
Well, PulsePoint is a software app that actually will alert any CPR provider of an event and allows early detection so that very early on you get CPR provided to that patient.
Well, we've known for years and the very importance of learning CPR in the American Heart Association. Also, American Red Cross teaches, CPR too, but we know it's important to know CPR. Tell us a little bit about the history with CPR.
Well, CPR's been around since the 1700s. It actually started in Paris with research in drowning victims and providing ventilation only. And through the course of 3 centuries, CPR and the research by the American Heart Association has proven that CPR is the key to survival. Without CPR, your chances of surviving a sudden cardiac event are very low. In 2008, the American Heart Association released a statement urging any bystander who witnesses a sudden event to activate 911 and then provide rapid, fast, push hard and fast chest compressions until the EMS service arrives.
Well, John, tell us why this PulsePoint is so important in our community.
What PulsePoint does is, you have to remember when you talk about cardiac arrest that for every minute that a person's not breathing or their heart stopped, the survival chances go down 10%. So that's every single minute. So if an ambulance takes 4 to 5 minutes to get to them, that's a 40% reduction in the chance of survival for that person. So the quickest that CPR can be started right from the beginning, the better outcome the patient has. This app provides a way that the community can be alerted if they are willing and they're trained in CPR. They can be alerted if something happens close to them and begin CPR immediately.
Now we're hearing the word app, so let's be very basic for our audience to make sure we understand really what an app actually means and when we talk about it being downloaded. So tell us a little bit more about what PulsePoint actually is.
PulsePoint is an actual application for the iPhone or the Android device, whichever cell phone you have. It's a free download, doesn't cost anything at all. They download the app, they subscribe to the Hardin County, it's listed as Hardin County EMS sector of it, and from that point on, the app does the rest for them. It will alert them if they're within 1,700 feet of a cardiac arrest in a public place, and it's very easy. If anyone has a problem installing the app, they can call us and we'll help guide them through it. I know some of the older population of my parents, if I tell them to download an app, they just look at me. So I'd be more than happy to help anybody that needs help setting it up.
Right. Usually you just have to go hopefully to your applications on your phone,
Right.
search the PulsePoint, and then it should come up and be able
Right.
to download it, correct?
Right, correct.
All right. Now, that's not going to delay 911 from getting there. So
No.
if something happens, tell us a little bit about what
The
911.
really great thing is once someone picks up the phone and dials 911 and they tell our dispatchers that someone has suffered a cardiac arrest, they literally type in cardiac arrest into their computer. That does several things. It brings up a protocol for them to tell them how to do CPR. But with PulsePoint, what happens is just by typing that in, it is automatically through computers, automatically launches the app. The dispatchers do not have to do anything extra that they've not been doing in the past. It's totally automatic with the word cardiac arrest typed in. They go about their business dispatching EMS, fire department, and anyone else they need, but it's seamless, automatically goes out within seconds of receiving the call.
So we've been talking really about anywhere, any place within our community, within the Hardin County area. Is that what I'm
Correct.
understanding? Sharon really stressed, I think, the importance of calling 911 as a first step, and that's what the American Heart Association has really trained us all to do. So we still need to do that.
Yes.
Then once 911 is activated, then the application starts,
Right.
I guess, alerting those individuals.
The interesting thing that we found in the testing that we've done for the last 2.5 weeks is a lot of times when a call comes out, the PulsePoint app is actually alerting us anywhere from 30 to 60 seconds before the ambulance is even dispatched. And that's because the software that's installed at Bob's place detects it immediately. Once they type in cardiac arrest, it detects it immediately and sends it to the app. So you're even getting a 30-second to a minute head start on the ambulance, to be honest. So.
Now, when an individual downloads the app, and I'm going to ask you, John, I guess, on this one, when the individual downloads that app, what actually comes up on my phone? Does it tell me how to do CPR? Does it instruct me as far as the next steps?
When you download the app and you're in a public location, I'll stress that, we'll talk about that in a minute, within 1,700 feet or a quarter mile of a sudden cardiac arrest, it'll alert your phone with a tone that you probably are not familiar with. It's a different sounding tone. It'll say that CPR is needed near your location. It gives you a exact map with a GPS location of where you're at and where the patient's at and guides you to that patient. It not only does that, but tells you where the closest defibrillator is, public defibrillator, tells you how to get to it and get it to the patient. The interesting thing is a lot of us have CPR training through our employers, and if you don't use it, you tend to forget it or be anxious about using it. The app actually also guides you through the CPR process. Once you get to the patient, it asks you if you need help with CPR. If you click yes, it actually steps you through and shows you a video of how to do chest compressions.
So, Jamie, what about the liability? What happens if I don't know CPR, but I download this app?
With anything, there is liability. However, Kentucky has a statute in place that keeps everyone safe and under that umbrella where liability is minimal. Whenever you're doing CPR, it's Good Samaritan law where you're acting as one should. Healthcare providers are covered under their individual directors.
So actually, downloading the app is free.
Right.
We're doing a good Samaritan by really learning, but those individuals that know CPR can then get to the scene as quickly as they can.
Right.
And then what happens if it happens in my home? Bob, tell me a little bit about what happens if I have a cardiac arrest in my home. Will people come rushing to my house?
No. The way the app is set up, and again, everything is done through the software in our computer system at 911, we actually tell the software whether it's a private residence or a public place. Public place can be a street, a shopping place, a church, things like that. But your private residence, it is restricted. The call will not go out. It will be handled as we normally do with EMS and the fire department. And the purpose for that is you don't want a bunch of strangers generally coming running to your house or busting in your house when something happens. It needs to be a professional that comes to your response.
John, other comments on the public?
I think the biggest thing is the public has to realize there really is nothing to be afraid of. The alerts only happen in public places, like Bob said, and with the way that CPR is taught today, with hands-only CPR, you don't have to do mouth-to-mouth. No one really should have a fear about trying to help somebody. This gives all of us, my family that download the app, everybody that's not medically trained that's in my family, it gives everybody a remarkable chance to make a big difference in someone's life. And I don't think that it should deter someone or scare them away from doing CPR. You know, Good Samaritan laws protect people that do what's best for people, what any other reasonable person would do. And if we could improve this link in the chain of survival, it's amazing what else, you know, who knows what else we can do in the future.
How many other communities actually have this application?
There are currently 1,400, I believe, 1,400 or 1,700 nationwide, but east of the Mississippi there are only about 14 currently. In the state of Kentucky, active programs at this time are only in one community, which is through Erlanger Hospital. That's the only community in Kentucky currently that's active. There are others that are in the working stages of getting it like we are. So what we hope is we start a trend and we get it here in Hardin County, and then maybe Louisville sees it and gets it in Louisville, Bowling Green, Nelson County. We hope it becomes contagious, because then what you're doing is actually expanding that umbrella of potential responders in the event of a sudden cardiac arrest.
So this is available in the Hardin County area. You would download it if you went maybe on vacation or went somewhere else. It may not necessarily work, correct? It's only in the Hardin County area.
It may not, but if you get to a community that is PulsePoint connected, is what it's called, and you get to the community and you're on vacation, let's just say not many of us go to California, but if you go to California, there are a lot of communities that are. You can actually register to their service in the app, and you'll be alerted wherever you're on vacation if a cardiac arrest happens close to your location. So you can use it nationwide as long as the community is a PulsePoint community.
So literally just taking a couple of seconds, which is what we started out talking about, and making a difference in this life-saving change by helping other individuals. You can download this application on your phone, have it and be ready to go when you're out in the public places, and really make a difference in the care of, in the quality, and getting them immediate attention in a cardiac arrest. Jamie, tell us a little bit about cost. We've talked about the quickness that we can help another individual. It's hopefully free to download. Is that correct? And any cost to our taxpayers?
It is free to download. You just go to your app store like we talked about previously. There is a yearly fee and an initial startup fee. Those fees are minimal in comparison to someone's life. However, all services have ventured together, and Hardin Memorial Health especially has really went on board and helped out with us and the 911 center with this app, and taking care of the cost for those throughout. I believe the startup was approximately $18,000 initially for the first year. Of course, that has to deal a lot with the IT and a lot of the stuff that takes to get it started and running. Every year after that is approximately $8,000, which, once again, like I said, it's very minimal in comparison to all it has to do is work one time and save one person's life.
Right,
So.
that early intervention, and we talked about that at the beginning, Sharon, is so critically important by making sure that person is getting that attention that they need. When you download the app, I know there might be differences when the individuals that know CPR, does it actually tell you if it's a child versus an adult in how you actually would do
It does
CPR?
not. It does not. It just tells you that there's a sudden cardiac arrest within so many feet of your location. So it doesn't specify whether it's a child, whether it's an adult. You'll have no way of knowing that until you would get to the patient.
Does the application work you through that process?
It does.
Okay.
It does. The big thing is it's hands-only CPR. It's not like it used to be where we had to teach people you do 30 compressions and 2 ventilations, and everybody was scared to do mouth-to-mouth, which I understand. I mean, that's a concern. A lot of people don't want to do mouth-to-mouth. So with the hands-only CPR, it's very self-explanatory. We can teach 100 people hands-only CPR in 30 minutes. I mean, if we had a group of 100 people, I could teach them all in 30 minutes.
But again, when we talk about the exposure that people might have in our society too, and making sure that you're there helping those other individuals, but also, making sure you're taking precautions for yourself, hands only.
Right.
There you go. I mean,
Right.
you're there ready to help somebody, in a safe manner.
Right.
So you're able to do that. Now, we've talked about that early intervention. We've talked about downloading that application. Tell us a little bit about the protection that the individual has. We've talked about that with the liability there. 911 gets to the scene. We've got trained individuals that are out there with the emergency medical services, and then possibly ending up at our emergency department at the hospital. So that's why all of us are all involved
Right.
in making sure that this is available to our community. So Jamie, let's go back a little bit to the liability and discuss what happens if that application is activated on my phone. Will they know who I am?
No. If you're within that radius at 1,700 feet and your phone activates that there's a CPR needed within your radius, all we see on a map is a little person, or a person meaning a symbol. We don't know who you are. We don't know your name. We don't know your phone number. We just know someone that has the app downloaded, whether they're CPR trained or not, but they've got the app downloaded, is within that radius. Once again, if you do or don't respond, you're not liable. If you don't respond, you're not liable. We don't know, once again, who you are or anything. So
EMS is able to see, and maybe 911, I'm not
Yes.
sure who all can see, but you
Right.
maybe it's a football game and there are
Right.
17 little
right, as administrators,
light ups or whatever.
there's only just a couple of administrators where we have to have access to work out any bugs or add AEDs to the program or things of that nature. And all we see, once again, is if an event happens, we see little figures that come up on the screen that they're in that area and whether they respond or not. If they don't, there is no repercussions. That's self-choice if you do or don't. However, we do recommend and hope that everyone that has the app that is within that radius does respond, because that could save someone's life.
Well, and absolutely, because what we've been talking about too is that it really talks you through what the next steps are, and then also the access to an AED. Let's talk a little bit about an AED. Maybe a lot of our viewers don't even know what an AED is. Jimmy, you want to take that?
Sure,
Or
yeah.
Go ahead.
So an AED, it's an automated external defibrillator. They were initially made and still are made for a layperson, meaning they have no formal training at all. They're traditionally in open areas. They come with pads, and what they're utilized for is in sudden cardiac arrest, where there's no breathing, no pulse, you apply pads to the person's chest, and it analyzes to see if the heart is in a specific electrical rhythm that the energy can be utilized to change that rhythm to a normal rhythm where the heart is functioning appropriately. And not in all cases does it actually utilize the energy and change the rhythm, because there's only a couple of rhythms that it will defibrillate or shock someone.
But that again too is pretty much computerized by
It
telling
is.
you step by step.
Yes.
Apply now.
Yes.
No.
Everything has
No shock
the
needed.
pads. It actually, every one of them, you push the on button and it tells you step by step what to do. And then also the pads that comes with the device actually has pictures of where to place them on a person's chest.
You know, I'm hearing as we've been discussing the importance of PulsePoint, we really want to encourage our viewers to learn CPR.
Yes.
And they can do that in a lot of different ways. John, do you want to tell us how we can
There
learn
are
a
a
little
lot of
bit
different
more?
ways here. Hardin Memorial Health does CPR training. We do CPR training to the public. The American Red Cross does CPR training. A lot of our marketing campaign as far as pushing this out to the public is going to be promoting CPR training, maybe having a hands-only CPR day, and try to get 200 or 300 people there and just teach them hands-only CPR. So maybe a couple of the flash mob things, CPR flash mobs that you've seen or whatever. And so there's so much opportunity for us to get out and get the public involved and get them. They're the big part of this app. We can sit behind the desk all day long and look at the people that have the app and look at all that data. But if people don't download it and people don't use the app, then we're not really accomplishing anything at all.
Right.
Absolutely. So this is very important, again, to maybe look into downloading the app on your phone. We talked about the different types of phones that it's available on your iPhone and an Android phone. It's free to download. And then also maybe looking into the possibility of learning CPR. I mean, this is very important to learn CPR. When do we anticipate this launch of PulsePoint in our community, John?
We're anticipating the launch of PulsePoint December, the middle of December 2015. That is our goal. We have a few things we have to work out over the next couple weeks, so we're hoping by the middle of December in 2015 to have it going.
Well, I'm going to direct this next question to Sharon and Bob. So when somebody actually is having a cardiac event and that person may be with them, that first step again is to do what?
Activate 911, and if you have someone around you, certainly ask them to activate 911 and you start chest compressions.
Right. Don't ever drive yourself.
No.
We want to stress again, ever, 911
Right.
is what we want to have them call and make sure that they're getting that attention. Obviously, we've learned today too that that's going to activate then the PulsePoint in our community, and how fortunate we are to have all these organizations come together to have this life-saving resource available to us. Anything else that you'd like to share with our viewers?
I would just re-emphasize what John said. All of our efforts only work if the community will sign up for the app, get CPR trained, and then use the app. Truly takes a community for a patient to survive.
It absolutely does, and that caring for each other, and I think that's one thing that's great about Hardin County is we all live and breathe and work with our families and our friends, and we want to care for each other. So very good point, Sharon. We'd like to thank our guests for joining us today, and hope you tune in next month for another important edition of Health in the Heartland. For more information, definitely they can Google search PulsePoint, is that correct?
Right, that's correct.
And then also go to our website at www.hmh.net, and don't forget to download that application on your phone and also learn CPR.